Procedures of the face. Now, which part of the face? That depends. So there's a little bit of modification to this depending on which specific part of the face. For example, do the eyes need to be in the field, or is it better to cover them? Depends on what you're doing. Maybe the eyes need to be exposed, maybe they need to be covered. But the draping procedure is essentially identical regardless. You're going to have the face prepped, right? All the things we talked about as far as preps, know what kinds of things are safe, which things aren't. Possibly have things in ears, cotton balls in ears, that sort of thing. The hair is not part of it, so it's not part of the drape. The person's got a hairnet. Give me a hairnet, please. Put a hairnet on this guy. So we've prepped whatever. Maybe we're doing sinus surgery. Maybe we're doing a blepharoplasty, reshaping the eyelids, whatever the case may be. These, I don't know if you noticed this or not, but on your patients, these hairnets often don't stay very well. You'll find that they're slipping off. These guys are probably not going to stay very good either. All right, so we're going to end up covering the body of the patient. And you may do that before, you may do that after. There's a few options for that. The book discusses that to some extent. But the main part that we're particularly interested in is going to be the head itself. And what we need, in addition to this guy and the drapes that we have here, we need, and this will be sterile, be part of your sterile set, you're going to need a towel clip. Okay? So we need one of those. I notice our instruments are not out. Here, I can use this. Non-penetrating towel clip of some kind. Wouldn't have to be this kind, but you need a non-penetrating towel clip. Bring me up that stand over here. Really all we need is a couple of sheets. Or alternately, one sheet and some towels. Now, I'm going to do it with sheets to begin with. And you can see how you would modify this with towels. You're going to get your sheets ready. So here's a couple of sheets that are about right. And it doesn't really matter how big they are, but too big of a sheet can kind of become unwieldy. These are the smaller sheets that we had, and they're both identical, 44 by 58 sheets. So I'm going to, let's imagine that this is all draped out and sterile. So you're going to prepare this in your sterile area. Just going to open up one of the sheets. Now you don't want this stuff to fall off, right? You got to be careful about that. That's kind of the tricky thing to do in all this, is dealing with sheets and not letting them fall where they shouldn't be. That's the hardest part of this whole thing. And I don't just want one, I want two, but I also want to open this at least somewhat. I'm going to open up this one somewhat. I'm going to leave this part down here. I don't want it falling off my table. Okay, and I'm going to do another one. I'm going to cover it. Okay? So I've doubled it up. I have 2 layers of sheets here. I'm trying to not let them fall off. Okay. Now, I'm going to have to, the idea here is I'm going to take those, I'm going to put them underneath this person's head. The bottom sheet is going to form a drape over the table. The top sheet, I'm going to wrap around the head. Now that's the whole principle of this whole thing. Still need help though. So this patient's intubated, so the ET tube may be draped or prepped in, maybe part of the prep. So you've got prep solution on the ET tube. It's in there somewhere, right? So it's exposed. There's no good way around it. You may kind of tape it to say the side of the patient's face or whatever, but it's there. So you're gonna have to deal with that. And it usually, well, it can be inside or outside the towel. Typically inside. If it's outside, then you have a whole lot of it that would be potentially, no, I guess it always is inside the towel. So somebody's gonna have to hold this person's head up, and you have to do it in such a way that you're gonna get in there. So I need a helper to do that. Hold the head up, take the donut out, the donut's in my way. Okay, you gotta gather this all up in your hands. This person's going to stand aside, best you can. You're going to place this under here. At that point, you can let these uncurl the rest of the way. Okay. You're going to take the top drape. Okay, you can set the head down right on top of it. Take that top drape, and you just wrap it over. Now, depending, like I said, do you need the eyes showing or not? That depends on what you're doing. You either cover the eyes, you leave them exposed, but either way, you cover up as much as you can so that you only expose the part that's necessary, and then you take your towel clip, obviously making sure that you don't pinch the patient. And there's that. What about the rest of the body? I mean, this is the head drape. When we refer to head drape, this is what we mean. But if you're doing one of these procedures, obviously you gotta do something about the rest of the body. What do you think you might do?
Drape it.
Yeah, you can just use, they make different drapes. There might be a special drape. You know the U-drapes we saw before? You could use a drape like that. That's a U-drape that adheres right there, and you can adhere it down there. That would be a really good choice to use. You could use a flat sheet, cover the patient, but then you gotta be a little careful with these areas right here because, you know, do these drapes overlap? You want a nice overlap. So I would suggest a adhesive U-drape to go right there. Alternately, you could put a drape over this and then clip them together with more towel clips. That would help hold it together. That would be an option as well. Your book actually mentions both, clipping them or the adhesive U-drape.
I actually saw a head drape. It said head drape on the package this morning.
If you're doing something like craniotomy, that draping system is a little different. Typically for a craniotomy, you've got a drape that looks a bit like the drape that we put on the arm. It's fenestrated, it has a sheet of sorts with a hole in it, and it lays right on the patient's head. And then you can either incise through it sometimes, or perhaps just open. A lot of times it gets stapled to the scalp because it's really hard to keep that from shifting on a person's head.
How?
The surgeon may instead decide to do towels that are again stapled to the patient and then covered up with other drapes. There's a number of different options for craniotomy. Now this is one we can practice. Okay, it's not that hard. You saw that, right? So I'm gonna let some of you practice this one. That means we got to refold some sheets, but these sheets are simple to refold.
It's either here and it doesn't stay on.
Put this over here, lower the